Hey everyone, Dr. Charlie Johnson, physical therapist, and today I want to talk about why a herniated disc is the #1 cause of sciatica. So one of the things that I truly believe in is that if you understand what's going on and you understand the concept behind what's going on, then you start to have some knowledge and understanding that you can use to your advantage. So you can start to kind of heal and treat yourself. Okay, so here we go. So if you can see here on this side of the screen or on this side of the board, this is your pelvis, here's your lower back. There's 5 bones in the lower back. Here would be like your kneecap, and you'd be facing this way. So this would be the front of your body, and this would be the back of your body. So what I did here is I just pulled out 2 of the bones and kind of blew them up. Okay, so this right here, the back side, is what you would feel almost like the little spikes on the, you can feel if you run your fingers along your spine. And this would be the front, okay? So what we have here is just 2 bones, all right? The fancy term for this is vertebrae. So we've got L4 and L5. This is the most common level of a disc herniation. And what we see is that L4 just stands for the 4th bone in the lower back, all right? So I said there was 5. This is the 4th bone, or the lumbar bone, the 4th bone in the lower back. This is the 5th bone in the lower back, L5, just L for lumbar. And what we see is that in between these, we have a structure. And this structure is the disc. What we know about the disc is that the disc is made up of sort of this outer covering, kind of looks like the outside of like a hockey puck or a basket, all right? And that helps contain some material on the inside, okay? And that material, or that kind of fluid-like substance, is 80% water. And we actually know when we look at it on MRI, when people move front to back, that we do get some movement of this material within the disc, all right? So now the main issue is that not in all cases, but if sciatica does occur, the reason that a herniated disc is the #1 cause is because of this. So what do we have right behind the disc running through this canal? This would be your spinal cord, all right? So we've got spinal cord. And then what do we have coming out between this hole here? Well, we have nerves, all right? So these are spinal nerves. Now what we see is that some of the most common mechanisms, if you've seen my 7 telltale signs of a herniated disc, are that you're bending forward, and that you're in a bent over forward position and lifting something, or maybe you were stooping over picking something up, or you started to notice back pain after a long car ride. What do all these things have in common? Well, what they have in common is that they're all sort of in a forward bent position. So kind of take this idea here, right, and now picture that I'm zoomed in on these bones and I'm bending forward, right? So you're in this position. What we see is that we're actually putting more pressure on the front. So more pressure on the structures in the front and less pressure. We're almost gapping it. Think of like a slinky, right, in the back. So what happens if we look at this model here, right? If I were to kind of, bend this forward, what would happen is there would be a lot of pressure here, which would, if you think about it, if you were to put pressure on this structure and it had some liquid in it, well, the liquid, or in this case the disc material, would migrate or push towards the back, all right? And in a lot of cases that's fine, but what we see is that the outer third of the disc is controlled by nerves, which means that it has the ability to cause you pain or problems, all right? Now if it pushes far enough, what we see is we see a bulge that actually presses on one of the spinal nerves that sends feelings of numbness or tingling, and a whole bunch of other weird feelings down one or both of the legs. Usually, the more severe the issue, the further down the leg the issue is. So hopefully that helps you understand. Just get that a herniated disc is oriented in a way such that when certain pressures are on it, and or there's certain problems with it, it can push on the nerves, which are actually not too far behind it, okay? The good thing is, in most cases, you heal perfectly fine, and no need for invasive surgery or anything like that, okay? So that's why and how a herniated disc is the #1 cause of sciatica.